and welcome to today's live session. I know it's pretty late, but this is the time I get. So here I am on live, and today we will be talking, like announced, about breastfeeding positions. So this live, we do plan to do a couple of them. So I'll be taking subtopics, very small topics every month. Hi. So very small topics every month to discuss about these very small subtopics. We may also call some experts if there is any specific topic that we want them to address. So these topics will give you a gist about those minor topics, minor issues that we usually discuss in childbirth class. Of course, if there is any questions that you would like to ask, please feel free to ask either DM us or you can ask on the comments, and we'll be happy to answer. This video will be up on our page for 1 week. Post that, we will delete the live session videos, right? So that's on that. Yeah, so today we will be talking about breastfeeding positions. So to begin with, I know breastfeeding is, there are many things to be spoken about in the session of breastfeeding. One of the topic is breastfeeding positions. But to start off with, before a mother sits down to breastfeed her baby, it's very important that you choose how you position yourself. How is your posture? So we always recommend that a mother sits in a proper 90 degree, a proper 90 degree setup where she doesn't have to slouch, not these, lot of sofas with a lot of these cushions where she needs to like really struggle to get off. A pretty firm chair, a pretty firm setup where you're able to easily sit and get up. Have preferably a chair that has armrest, because either you're after your delivery, after C-section, whatever is the case, having a good armrest will give you good enough support to also keep your arm and hold your baby and guide the baby. Yeah, so that's the second thing. And have a footstool also, because when you have a footstool, your legs will be at 90 degrees, which will eventually support your lower back. And lower back is something that needs to be supported right after delivery, because if you see, that's the part where your bone, your spine moves backward to kind of open the birth canal and let the baby out. So there's a lot of things that goes on during birth in your lower part of your body. So you need to give it that amount of rest and care after your delivery. So ensure you also have nice cushions at your lower back, and you have a nice footstool which give you enough support in your lower back, and have this setup ready. And where do you have this setup? Have the setup in a place which is quite private, not too noisy, not too distracting, that is very calming, soothing for you. You can also choose to add some music around if that works for you. Whatever is calming for you, you can add that. A lot of nature, whatever is calming for you. Have that environment when you are choosing a place to have this whole setup to breastfeed your baby. So this setup and this positioning is very important. The second thing that's important is, always you do not go and bend down to breastfeed your baby. You always bring the baby to your breast to breastfeed. You don't slouch and breastfeed the baby. What happens is, if you're going to slouch and breastfeed the baby, at that point it might not look very strenuous because you're doing it once or twice. But if you do it over a period of time, you're going to exert a lot of pressure here and you will end up having pain. Yeah, so this is, and after delivery, you need to take care of your posture a lot more, because your core is weak, your back needs to be strengthened. So you need to cushion yourself well, position yourself well, be upright, and bring the baby to your breast. You don't go to the baby. Okay, so that's one thing to remember. All right, so now we have our breastfeeding place set up. We know how to set it up, where to set it up, We know how to start off with the baby. Now we'll see what the breastfeeding, different kinds of breastfeeding positions are. The first breastfeeding position that we will talk about today is the cradle hold. So in cradle hold, you will take the baby here, you will hold the baby. So this is a newborn baby, right? So there is no neck control for the baby. So you will hold the baby in your elbow like this. So this hand is free. So use this hand to hold your breasts and establish a good latch with the baby. So the baby is like this. I'm using a normal pillow here today. So I place the baby, I'm sitting upright. I have the cushion or the pillow here and I'm placing the baby on the pillow, right? In cradle hold, you use your elbow. So your baby's head will be at the, what is this, the joint here. So you'll use this to navigate the baby, okay? So you'll use this to navigate the baby and you'll bring the baby. This is important because you turn the baby like this and then you feed the baby. Why do I say turn? We say tummy to tummy. Your tummy and the baby's tummy should touch. Because even we can't drink like this, it's very uncomfortable. So you turn the baby fully and make it more comfortable for the baby to drink. So you hold the baby like this in cradle hold. You hold the bum of the baby or the upper leg and turn the baby like this, tummy to tummy, and you feed the baby, okay? One more cue. So one tip is your tummy to tummy. Second thing is ensure the ear, the shoulder and the side of the baby is in one line. So these are the two ways you can know that, okay, now the positioning is right, the turning is right, the cradle hold is working. Now the next step for you is to establish a good latch. Yeah, so cradle hold is what is most commonly used by most mothers, and this is one of the techniques you can use. The second position, so this is cradle hold, okay? The second position that you will be using is called cross cradle hold. Over there, the newborn baby, you will hold the head of the baby like this. So in cradle, you used your elbow to support. Here you're using your hand to support the baby's head and the baby's body is parallel to your body, okay? So it's like this and this hand is free. So you use this hand to hold your breast and guide the breast into the baby's mouth, and this hand you will use to navigate and turn the baby, all that. So again, the same rule applies. You turn the baby tummy to tummy and then you feed the baby like this. This is best for babies who have some latching issues. For whatever reason they are not able to latch properly. This is a good position to try again to latch the baby like this, okay? So this is your cross cradle hold. So cradle hold is this, where you're using your elbow. Cross cradle hold is you're not using your elbow, you're using your hand to guide the baby towards your breast and you turn the baby like this and feed the baby, okay? The third position is called the football position. Now this is a very interesting position and this is almost a position that I loved when I was breastfeeding my baby because it was very comfortable. Football position is where you take the pillow to the side. So you're not keeping it in front, you're keeping it in the side. And then you take your baby, put the baby in the side and you hold your hand like this. Of course it will come around. Hold your baby's head like this and bring them to your breast like this, okay? This is a fantastic way because most of the babies who have difficulties in latching latch very well in football hold. This is called football hold. The baby is perpendicular to my body, okay? So it's like this, okay? So football hold is very good if you're having a premature baby or a baby who has low birth weight or tiny babies, and also if you're having twins, having two babies on both sides, you can feed the baby. This is also a very good position for mothers who have big breasts. So when you're doing like this, there is a possibility that you kind of cover the nose of the baby because of the size of the breast. So if you're having a big breast, a football hold is fantastic. So for premature babies, small babies, for twins, for mothers with big breasts, this football hold is a fantastic position and most of the babies latch very well when they are having a football hold. Lastly, it's also very good for mothers who've had a C-section Because what happens in football hold is you're not putting any pressure on your abdomen region. You're bringing the entire pillow and the baby to the side, and the baby is only taking your breast here. So there is nothing, no hindrance in the front part. Your abdomen area is free. So this is football position. Okay. So once football position, you can try all these different positions. You can try cradle, you can try cross cradle, you can try football. See what is working best for you and your baby. So even me or anybody cannot tell you this is what will work for you. It's something that you and your baby need to do by trial and error and figure out what is working best for you and your baby. Yeah. The last position, or the second last position that we're talking about, is side lying position. It's my favorite position because I'm still feeding both my 2.5 and my 15-month-old, and it's a position where I don't have to get up, sit and breastfeed my baby. I can just lie down and sleep. Especially during night feed, this side lying position is a fantastic way because the mother's sleep doesn't get disturbed. You just turn, feed the baby, you also go to sleep, the baby will feed and unlatch, over, that's it. So your sleep is safe. So side lying position is a fantastic position, and also side lying position is good if you're a mother who's had a C-section. So this is also good in case you're not able to sit up also. You don't have to, you can just lie down in your bed fully flat, just turn to the side and feed the baby, that's it. So how does the side lying position work? So imagine this is your bed, okay? You're sleeping on your bed like this. So what happens is, this is your baby, and what you do is you turn to the side, okay? You turn to the side, you bring the baby, so hold the baby, support the babies with your, imagine I'm sleeping, okay? Support the baby with your elbow, turn the baby a little bit towards you. You can also put some cushions for use right after delivery if you're feeling that, you're feeling a little weak in your hip region or etc. You can put some cushions so that you're supported in your back, and then hold the baby. Now you are supporting the baby, cushions are supporting you. You can use some pillows, but mostly it's how you position the baby. So bring the baby like this and just feed the baby. That's it. So you're basically lying down in your bed, you turn to the side, you bring the baby like this, you turn the baby towards you and you feed the baby. That's your side lying position. Now, like I said, this position is fantastic if you don't want your sleep to be disturbed. But of course, in the initial few days as a newborn baby, they're still getting used to being outside your womb. They may cry for various other reasons. There will be times you'll have to wake up often, but eventually side lying position is something that will come handy, going further. And also, like I said, for C-section mothers, it's a boon because you don't have to exert any pressure here. You just lie down and feed the baby. If the baby is done feeding here, you just hold the baby like this, turn to the other side, and again support the baby and feed on the other side, and you're done. So how do you roll over and shift to the other side and side line? You feed the baby, then after feeding you unlatch, you hold the baby, turn this side and then feed this side. Okay, so that is side lying position. So we saw 4 different positions. We saw cradle, cross cradle, football and side lying positions. So these positions can very well be used for newborn babies. See what works for you and your baby. Okay. The next position that we're going to talk about is called saddle. Saddle is basically where your baby sits like this on your lap and feeds. Now this, of course, newborn babies will not be able to do. Around 10 months or so, when your baby is able to sit well without support. I wouldn't recommend this for babies who are not yet sitting developmentally, because you don't want to put extra pressure on their spine. So again, saddle hold is not for newborn babies. Saddle position can be tried for babies who are able to sit up, right? So here the babies sit up and they will directly feed from your breasts. Breastfeeding position for toddlers, they're going to be creative. they'll be all over the place. You'll have the baby's leg on your face, and they'll be 360 degrees. They'll be all over your body, and they will feed. So there is no breastfeeding position for toddlers. They're going to be adventurous, and they're going to be very, very creative with you. They only invent their own breastfeeding positions. So if you plan to extend breastfeed, and if you're planning to feed your baby beyond 1 year, there is no breastfeeding position that I can safely tell you, because that's up to your baby's creativity. But these positions, these basic positions, are here for your newborn babies in the initial phase of your breastfeeding. So like I said again, these are here as your tools. So I'll repeat. So you have your cradle hold, you have your cross cradle hold, you have football hold, you have sideline position for newborn babies. So these are your options, and see what works best for you and your baby. Yeah. Sometimes each side may also require you to try different positions. Because for me, in one of I had a flat nipple, so I used to do football in one breast, and I used to do a normal cross cradle hold in the other one, and then it eventually changed, and we shifted to complete cross cradle in both. So see what works for you. You don't have to, when you decide on one breastfeeding position and say, okay, this is working best for me, you don't have to stick to it throughout also. It can also change, because breastfeeding is a skill that your baby is also learning, you are also learning. So maybe the baby has picked up breastfeeding really well, and then other positions also seem to be working well for you and the baby. Be flexible with it. So each time, of course, there'll be a phase. Each time, see what is working, and be flexible with these different positions, and do what is working best for you and your baby. Okay. So that's about breastfeeding positions. If you, like I said, this video will be up on our page for 1 week. If you have any particular questions, doubts, please reach out, and I'll be very happy to answer them. Yeah? Thank you so much for joining. It's been a pleasure.